and welcome back to my channel. In this video we're going to be looking at why the babies in cryptic pregnancy are not picked on the ultrasound scan. So a lot of people have asked, like, how come the ultrasound do not pick the babies? So if it doesn't, what else can pick them? Because normally for a woman who is pregnant between the 6 to 7 week, the ultrasound will pick your baby. Even though they might not be able to pick heartbeat at this point, they will be able to see at least a sac in the womb, and that's a confirmation that there's pregnancy already progressing. From the 12th to 13th week, all of the activities of these babies can be detected, like the heartbeat and all of that can be detected at this point. Now, why is it that in the case of cryptic pregnancy, these babies are not picked up? Like, does that mean they are not in the uterus? Are they implanted somewhere else? Now, if babies are implanted in other places aside the uterus, that is referred to as ectopic pregnancy, because it's not in the uterus. It might be in the abdomen, it might be in the fallopian tube, it might be in the cervix, the ovary, but in this case the scan is still what picks it and diagnoses it as ectopic. But why is it that in the case of cryptic pregnancy you are told that the scan do not see the baby? How does that add up? All right, so that is what we're going to be looking at in this video. Ensure you don't go anywhere, and if you're not subscribed to my channel, please click on the subscribe button, turn on notifications so you'll be able to get updates when there's a new one. I've talked a lot about cryptic pregnancy, and the video links will be in the description box. You can check them out. Please give this video a thumbs up as you watch. That will help it get more visibility. Don't feel free to share, like, drop comments, and I'll respond to them immediately. Now let's go at looking at why ultrasound do not pick babies in cryptic pregnancy. Welcome back to my channel, everyone. Now, before we look at the reason the ultrasound do not pick babies in cryptic pregnancy, let's look at what cryptic pregnancy is. It is actually a unique kind of pregnancy that happens in 1 out of every 475 pregnancies. Now, a lot of people do not believe in the concept of cryptic pregnancy, but it does exist, and it happens in 1 out of every 475 pregnancy. It is quite rare, but it is with us, because we've had a lot of women who go into the restroom to ease themselves and they just go into labor. Some are lucky to be in the hospital by the time they fall into labor. So one thing with cryptic pregnancy is that the pregnancy tests usually come out negative. Blood test, urine test is all negative. Ultrasound do not pick the babies, and there is no visible signs of pregnancy like the baby bump. There's no baby bump, so it's really difficult, and that is why it go more unnoticed in women who are a little bit overweight, because in this case they are big, and if there is a slight increase in their stomach size, they will still not take note of it. So you see that these women can be really hit by cryptic pregnancy. Now, in cryptic pregnancy, there are no known signs and symptoms of pregnancy. Some of these women might get like nausea, some vomiting, but it's usually very mild, and they might attribute it to something else because of the fact that the pregnancy tests keep coming negative. Now, and with cryptic pregnancy, the woman gets her menses. It's usually referred to as a pseudo menstruation. It might not really be as big as the regular menses, but it keeps coming, and because you're getting it all the time, it's a pointer to you that everything is okay. You might even be trying actively to get pregnant in this case, but you are already carrying a pregnancy. So you discover that it is very difficult to diagnose cryptic pregnancy for both the person pregnant and the healthcare team because of some of these signs and symptoms that are absent. All right, now people with irregular cycle will also get hit a lot with cryptic pregnancy because they are usually used to not getting a normal cycle. So they can miss their cycle at some point, and it wouldn't really mean anything to them because they're already used to having irregular period. And so when they are pregnant and there are no signs and symptoms, and then they are still having their irregular cycle, they will think that it is normal and they will not worry about it. Okay, so like I said earlier, from the 6th week to the 7th week, a baby is meant to be picked on the ultrasound. Even though there might not be heartbeat at this point, but there would be a sac to indicate that yes, something is here. And even if it is not in the womb, it will be picked wherever it is, whether in the tube or in the abdomen or maybe in the ovaries or somewhere, it will still be picked up. But in the case of cryptic pregnancy, ultrasound do not get to pick the babies. Sometimes women who do not know when they saw their last period may not be able to know when to go for scan, and by the time they go, they will not be able to pick their babies. In that case, it's actually an error on the part of the woman because she didn't know when she took in. That is actually some calculation error. But with cryptic pregnancy, there are two cardinal reasons why the babies are not picked up. Number one is the position of the baby in the uterus. Now, there is a position that the baby will assume in the uterus that the ultrasound will not pick it. More so that there is no positive pregnancy test, there won't be a need for so much thorough check on the part of the sonographer or the doctor. So in this case, they might just do their normal ultrasound check, like maybe a transvaginal ultrasound or an abdominal ultrasound, and just conclude that there is no baby. But that baby is there, and the reason it is not being picked is where it is positioned in the uterus. There are places in the uterus, even as pear-shaped and little as we think it is, that a baby might implant and it will not be picked by the ultrasound. Now, I have a friend who was pregnant with twins. The second baby was not picked until about 8 months of pregnancy, and that was because the baby was just positioned behind the other twin, so the baby was not picked up. All right, so the position of a baby will determine whether it will be picked up by the ultrasound or not. All right, so that is one of the reasons cryptic pregnancies are not picked up on the ultrasound, and it is not the fault of the sonographer because she do not have any knowledge of a pregnancy, so they will not be checking. Most times when they know exactly what your issue is, they are able to check properly. So if you suspect you might be pregnant but no signs and symptoms, discuss with your doctor, talk to your sonographer. Oh, this is what I think, so they know how to thoroughly check you to confirm if there is actually a baby there or not. Now, the second reason why an ultrasound might not pick a cryptic pregnancy is because of the shape of the uterus. About 96% of women have the normal kind of uterus, which is pear-shaped, but about 4% of women have uterus that are not of that shape, and this is usually referred to abnormality of the uterus or congenital uterine abnormalities. Now, in this case, the pregnancy might be implanted in the uterus, but it will not be picked because of the shape of the uterus, and this is actually not normal. Like a normal uterus is supposed to be pear-shaped in a way that whatever is in it will be detected. But for the 4% of women that fall into this category of having the other types of uterine shapes, they will have issues detecting pregnancies. If they have cryptic pregnancy, the babies will not be detected by ultrasound due to the shape of the uterus. These are the two reasons ultrasound do not pick babies in cryptic pregnancy. That's the position of the baby in the uterus and then the shape of the uterus. So this actually affects the ability of the ultrasound scan to pick up the baby. So you see that diagnosing cryptic pregnancy is very difficult, but cryptic pregnancy exists. All right, there are several testimonies as to that. So if you have anybody talk to you like, I have signs and symptoms of pregnancy, I feel like I'm pregnant, like a lot of women have reached out to me like that, all I say to them is ensure you meet your healthcare provider and follow up closely. Now, for women who are pregnant with cryptic pregnancy, it is possible to diagnose from 20 weeks, while some go unnoticed until the time of delivery. So if you feel like you are pregnant, you are sure that something is not right in your body, ensure you're following up with your healthcare provider. You can be tested like every 1 week apart, and then your scan can also be done from time to time to increase the chances of a diagnosis. Don't just sit in one place and feel like when the time is right, everything will be okay. You need to give the unborn child all the prenatal care that they need. And if you do not know you're pregnant, you will not be able to give them all this care. And when you give birth to the babies, eventually they have low birth weight, and you yourself is going to affect your psychological well-being as well. So ensure that you report whatsoever you feel in your system that is not normal to you, to your healthcare team. I know that a lot of women get bashed like there's nothing like that, just go home and all that, but don't give up. Hopefully you will get an answer to all your questions when the time is right, and I wish you all the best in your journey to conception. See you in the next video. Bye bye.